The findings, but it's such a fascinating story. We want to take a closer look at the trial. CBC's medical specialist, Dr. Karl, is with me this morning via Skype from Toronto, and great to see you. Dr. Karl, stem cells hold such promise in so many areas of medicine. What's the significance of their being used in cardiac cases?
Well, the whole concept behind using stem cells is that stem cells can sort of grow up to be any kind of tissue in your body. So in the case of a severe heart attack where part of the heart dies, and instead of muscle that is used to squeeze blood through the body, you get scar tissue, which is ineffective in doing that job. The hope is that stem cells can rebuild the dead heart tissue so that the heart will work better.
And in this case, the doctors use the patient's own stem cells. Why is that important?
Well, not only does it make it easier because they take those stem cells on the same day of the surgery and implant them into the heart, but because it's your own cells, there's no problem or worry around rejecting that new tissue that's going to grow in your body.
Okay. Kelly was mentioning in her report that there are modest expectations for this trial because these are early days. They've just done a few cases in Toronto and Montreal. So what questions do you still think need to be answered here?
Well, in the early days of any trial, you want to make sure that the intervention you're doing is safe and effective, that it's going to have a positive effect on the patient. But one of the other key questions that they're asking is how long after the event, how long after the heart attack where there's damage to the heart, will there be benefit from injecting stem cells? And I guess figuring out the optimum time after heart attack to implant stem cells, assuming that this is going to be an effective treatment.
So still some things yet to be determined or to be completely clarified, but come back again to the notion of promise. What could this mean for cardiac patients' survival and quality of life?
Well, when it comes to a person who's suffered a severe heart attack to the point where the heart's not functioning the way it should be, ultimately the final or the end of the line treatment for a patient like that is a heart transplant. But the concept here is that what if instead of putting in a brand new heart, you could take those parts of the heart that weren't working and sort of put in brand new parts of the heart so that the heart overall will work better. And that's, as you mentioned, years down the road, but it's an exciting prospect, especially if you can use a patient's own stem cells.
Exciting indeed. Thanks for telling us about it, Dr. Karl.
Thank you.